I'm Cindy Lyon, the chair of the Department of Dental Practice here at University of the Pacific, and I've been a CDA member for 25 years. CDA Foundation celebrates its 10-year anniversary this year, and it's been a great brand new history for us. Dentists by nature are such generous folks. We do so many things for our patients and our communities, our dental students, the state. So the foundation, in coming together over these last 10, has really pooled our energy, our resources, our advocacy in some very amazing ways. One of the special things that the foundation does that is near to my heart as an educator is student loan repayment scholarships. To date, the CDA Foundation, through the generosity of member donors, has been able to support 11 new dentists with loan forgiveness scholarships that reduce their educational debt and allow them to work in community clinics that care for underserved patients. These are probably practicing opportunities that these students or new graduates would not have been able to entertain without these particular grants and scholarships.
I come from a single-parent immigrant household. I was raised by my mother. She has a elementary school level education. Growing up, we've always had financial difficulties, socioeconomic barriers. It was very hard for us to communicate to healthcare providers growing up, what it is we're actually trying to relay. I feel very privileged now that I'm in this position to be able to be that person that can understand the patient. The gratification is immeasurable. Being able to understand and explain to people and having them just wholeheartedly confide in you. It's a true honor. It's something that really can't be measured in terms of the career path I've chosen is always what I wanted to do. And I feel very honored and privileged to serve the population which I serve today.
I would like to say that I'm glad that somebody thinks that the people out here are important and that they deserve care. I can say from my own background that many times there's a lot of misunderstandings about where people are coming from, and I don't like to penalize or punish the kids when it's not their fault, and I'm just glad that the CDA Foundation has given me this opportunity to help children and families have better health care. A lot of the teens that come in, we talk about what are you going to do when you grow up, and it's all making a difference in the community. That was done for me, and to be able to have the opportunity to help other people in that way means a lot to me, and I'm very thankful for that.
Having this grant has enabled me to live in the community that I grew up in, work on patients that I've known my whole life, and establish myself back in this community. We see a lot of patients every day, and these patients don't have the ability to pay for dental care. So they're on programs like Denti-Cal, Healthy Families. They aren't being seen at other offices. There are hardly any other offices that take these programs, especially for children. We see a lot of kids every day and give them the quality care they deserve. The generosity of the foundation has totally amazed me. I am shocked that this program even exists, and that there are so many generous donors out there that are willing to give so much to help young dentists succeed.
One of the things that makes me most happy to contribute to student scholarships, or loan repayment scholarships in particular, is the fact that I'm able to leverage myself. I can do my own community work, donate my time in nonprofit clinics in my neighborhood, but my hands only can do so much. So by virtue of CDA Foundation student loan repayment scholarships, I'm able to leverage myself. There's a new graduate working in a community clinic, seeing a very large number of patients that I can't literally roll up my sleeves and see myself. So it simply helps members do more than they can provide directly. I think the foundation really simply brings out the best in each of us. It reminds us why we came to dentistry, why we chose to participate in a profession that cares for people. I think our members really care very deeply for their patients and their extended communities. And the foundation simply allows us to do much more work in that area.
I would like to thank the CDA Foundation and its donors for allowing me this opportunity to be exactly where I want to be.
I would like to say thank you to the CDA Foundation for supporting me in my efforts to work in community health. It makes a very big difference, and it makes me feel that it is definitely all worth it. And thank you very much, CDA Foundation.
It's overwhelming, and I was in tears when I first found out that I had gotten the grant. And every time I think about it, it's just completely overwhelming. There's nothing more I can say, but thank you very much. Thank you.